Hello and good morning. Thank you for your patience, or good afternoon, depending on where you're joining us from today. If this is your first time tuning in, welcome. And if this is your second time tuning in, which I hope it is, welcome to episode 2 of the HVTN Community Café. I am Abraham Johnson, the HIV Community Engagement Officer for the Treatment Action Group, and I'm so excited to have you join us today for episode 2 of a series of community discussions on how on how COVID-19 efforts can help end HIV. On this episode, we will discuss how community engagement in COVID-19 research can inform ongoing efforts in HIV research. We will engage this conversation from the perspective of individuals from the trans experience. With that being said, I will allow our wonderful panelists to introduce themselves. So I will start with you, Chloe. If you don't mind, tell us where you are, where you're from, and what do you do? And preferred pronouns, please.
My name is Chloe Jordan, she, her, hers, herself. I'm a clinical research coordinator for the LIGHT study in Atlanta, Georgia, Emory at Grady. LIGHT stands for Leading Innovation for Transgender Women's Health and Empowerment. It is the first trans feminine cohort study in the United States, and it is headed by Johns Hopkins University.
Thank you, Chloe.
No problem.
Passing it to Jennifer.
Good afternoon or morning. I am Jennifer Barnes Balenciaga. I am in New York currently, and I do work for, I'm a, what would be the word? Transitioning person from Atlanta to New York. And I work for State Representative Park Cannon, District 58 as her LGBTQ liaison. And I'm also the director of Crystal LaBeija Organizing Fellowship and also do some consulting on the side. Crystal LaBeija Organizing Fellowship is a space specifically designed around ballroom participants for transgender nonconforming, non-binary individuals. Black and Brown is the focus for development and or funding, as it has seemed lately, due to the pandemic, for different projects that they have going on within community, whether that ranges from mass drives to starting their own media companies specifically for trans influence, trans feminine women. So.
Thank you so much, Jennifer. And passing it on to Ro.
Hello, friends. My name is Ro Yoon. I use she and her pronouns. I am the community educator for the Seattle Vaccine Trials Unit with Fred Hutch here in the lovely rainy Seattle. Intersections of identity. I am a first generation Korean American immigrant, a trans woman of color, survivor of heroin addiction. I got this work through Needle Exchange back up in active London in the late 90s. And happy to be here with everyone.
And passing it on to Jamel.
Hello and greetings to all. My name is Jamel Young. Pronouns are he, him, his, king, and boss. I am a research admin coordinator for Emory School of Medicine, clinical research unit here in Atlanta. I'm also the founder and executive director of TMSM Connect, which is a Black trans-led organization centered around signed at birth, transgender and gender nonconforming individuals who identify as bi, gay, or queer. Glad to be here, y'all.
Thank you. And last but not least, Naima.
Hi, everyone. Good afternoon. So Naima Sanchez, she, her pronouns. I am employed at the ACLU of Pennsylvania as their trans justice coordinator, and I am the board chair for the University of Pennsylvania HIV Clinical Trials Unit. And I am looking forward to today's conversation.
Again, thank you all. And you all look amazing. You all make me want to change clothes. So she came with the look. So I'll go ahead and get the question started. So I know that each of you live in different regions of the United States. How has the COVID-19 pandemic impacted your community?
I don't know if that was just a throw out, but I mean, I guess I would just, I don't think that for any of us, it's different. You know, I think COVID impacted, you know, everyone in the United States, if not the whole world, right? But just speaking on behalf of Philadelphians and Pennsylvanians and trans women who have engaged in survival sex work. Like the COVID pandemic had really slowed down the industry and employment and access to resources. So it has really hit our community in Pennsylvania pretty hard. So I'm just gonna leave it at that.
Sure, yeah. Definitely hit community in a way in which socially had to adjust. We come from a community where we're used to convening and finding spaces and creating spaces to engage with each other. But since COVID and shelter in place and things like that, we've had to become more creative in how to create these spaces, and sometimes not very successful in finding a space that feels still comfortable to engage.
Did anyone else want to add to that?
I have to agree with Jamil. Here in Atlanta, we had a light halt when it came to actually closing down the city. But the disconnect happened within the community, because now it's very difficult, if we're having a retention event for our study, to actually host a retention event that is not virtual. And once you have once you have a study that has always had in-person retention events, and now you transition to trying to do things virtually, it's hard to maintain that same connection. It's very difficult. And so now, especially on our project, it feels very difficult to just pull everyone back in to where we once were.
Definitely.
Certainly want to echo the words of Ms. Sanchez. Same region, Philly, NY, Jersey. More specifically, New York being one of the more outspoken spaces during COVID-19. Cuomo, if I may, his movement was very specific, and it was very intentional during the time of shelter in place, lockdown specific. Now towards the understanding of how long this span has become and will be, has become, I've noticed yesterday, 35% of the city is now going to be open as far as usage for spaces, even as far as, Madison Square Garden with 10%, quote unquote, being utilized. I just believe that the world is so gung-ho because of capitalist society to get back towards making money, and of course for others to be able to enjoy. And New York is nothing without its tourists and of course, without saying immigrants in general, but tourism is what drives the city. And so we're noticing now in the backlash of what hasn't happened, which is a mass close indoors that we're going to have to operate by the pushing of these vaccines, and more so how to normalize the way that we're living currently in order to keep us hopefully safe and somewhat sane in movement. So I guess I'm a little optimistic due to the ability and accessibility expanding for the vaccines, but I'm still been quarantining myself, so I haven't really done much if it's not work related or something that has to happen personally. So
Thank you so much, Jennifer. So moving on to the next question. Chloe, this is a perfect question for you. You talked about doing community engagement events, right? So how has the community adapted to the pandemic?
That's a great question. From my experience of engaging, and once again, this has been remote engaging, it's been very stressful. I like to make personal phone calls to each participant that's on our study, and each participant has a story. Every person, every trans woman has a story, and it's a pretty challenging story. And I have my own. I'm a trans woman myself, so I have my own, but it's pretty challenging. But I hear a lot of mental anguish because COVID brought a lot of things out. There's isolation. So you have to deal with a lot of things that before you had the speed of the world that you could just divert your attention to other things, but now you have to really come to grasp and deal with those things. And once again, it's disconnected and isolated. So now here you are with your thoughts and your feelings and your insecurities, and it's just you and that. So it's been challenging, very challenging.
Naeem, I see you doing something with your hands. Do you have anything you like to add?
Oh no, I was muted, but I was agreeing with Chloe is that you are left with this like, effort, again, speaking for myself as a trans person, a trans woman, is like you suffer from gender dysphoria, body dysphoria, and also other mental health issues, right? And this is just for myself, like depression. And when you have no outside outlet besides your four walls, it really drives you crazy. And like I know that places and resources like mental health resources and community-based organizations are trying to redefine what community connections look like. And it's really hard to adapt when accessibility to like internet is not there for everyone in community, like because people are experiencing homelessness, right? Or a lack of access to internet or financial resources, whereas though connection to the community isn't their first necessary need at this point, but financial security and housing security is, right? So we try to fix out like, with like, what is the perfect balance to like regaining this new normal with also in encompassing like people's personal issues and being isolated by themselves, right? So I was just agreeing with Chloe, honestly, and just like, I have my own stuff. I'm in a hotel in New York right now. I just had surgery yesterday, right? And I have a support system here, like a trans sister that's here with me. But without her, I would have felt like how I felt over the last year, like dealing with all of this and not having an outsource to like support, some help, something hands-on, right? And it's hard. It really is hard.
Yeah. How do you make it to the virtual trans group meeting to get support when you're having a hard time getting out of bed that day because you're just so depressed? And I hear depression a lot. Like I hear that one word a lot. But how do you overcome your own barrier to access, the support that we have now virtually?
Right.
What's going to also echo for Chloe, and also how I mentioned earlier that we've become more creative and creating these spaces virtually, but then also it kind of backfires. There's so many different virtual options, meetings, groups, events. People get zoomed out, and it's like you don't even want to see or look at a Zoom link after a while. And it's like, how else do we approach it? So it is an ongoing challenge that I personally am currently going through as well.
I love zoomed out.
Right. Ro, would you like to add anything?
I am the only one who's in the corner of the nation, and I feel blessed that as small as Seattle is, during this pandemic, we saw a lot of community action happen within the trans women of color community, or the Black and Brown femmes, and immediately mobilized with the TWOC, is the Trans Women of Color Solidarity Network, which to Chloe's point, when you just can't get out of bed, money helps that. And they, without question, provided money to our communities, everything from just daily living things without having to consider getting on that bus, going to work, or even if they have work. So I'm really proud that Seattle really banded together, and subsequently there's been other community groups, action groups that are doing a lot of COVID mutual aid and collaborating with other existing organizations. I don't want to say organization because they're all very small groups of people. So banding together, the power in numbers have been rewarding to see. So what I could see as an outsider, groups of people that never have worked together, banding together solely for the purpose of lifting up trans folks and femmes in the city, which is really remarkable.
Yes, community is important, and more than ever, community engagement is important. So just like shifting gears, focusing more on like community engagement, which has been a buzzword over the past year, especially in the age of COVID. Community engagement. For those who are watching us who probably don't know what community engagement, do you mind defining what community engagement is and why it is so important right now more than ever?
I'll take that since you asked me to respond to this. Thank you. Community engagement is just a foundation of awareness, literacy, support of not only the work that we do, but also building the trust and sharing information with the communities that are really big stakeholders. And in this case, listening to our Black and brown trans women, trans femmes, and working with the communities to really address some of the challenges, either in clinical research being inclusive to them, but more importantly, to really respond to the immediate needs of population that we want to recruit. So there are three components of community engagement that we value in clinical research. The first and foremost is community education. That's really to address misinformation, just to get people aware, the safety, things of that nature related to clinical research. And then the other components include recruitment, not only recruitment into clinical work, but also our community advisory boards or any kind of action group that our community partners are participating with us with. And then finally, retention. How do we keep, how do we maintain these long-lasting relationships with our community partners? But in addition to that, how do we maintain better relationships with our volunteers to keep them engaged?
Thank you, Ro. Does anyone have a different perspective of community engagement, would like to chime in or add something else?
I think it's wonderful to look at it in the aspect of those specific ideologies and statistics. Sticking with that is one part of it, but then it's like the other span where me and Chloe were speaking the other day about out in the field. Like, what does it look like to be engaging with those girls on the corners? You know, some of the beginning history of why I even started doing this work after doing a couple of presentations was working as an outreach person. And so what that looks like from an outreach in the span of actually testing, and then on the other side of recruitment for studies. So the relationship that you have to develop with the communities that you're a part of usually involves you being one of the people, you know, one of the ones that understands what it means to be a part of hardship, one who understands what it means to get resources in a timely manner. Also, jumping back to the emphasis on how COVID-19 has impacted certain types of funding, it is a joy to see some of the bigger grants that have been given have changed their face a little to more of like undebt or without restriction, unrestricted funding. And things like that are what the community need in order to create more of these funding agents where we can do more COVID relief, because clearly, as you can see, a lot of things that we were hoping for have been on halt. So there's still a constant need of filling the financial voids that are coming with these households, let alone the housing issues that have come along with the community that needs to be engaged. So what does it look like for us to continue to make ourselves readily available, but also taking care of ourselves as it pertains to engaging with the community, so you can do that in the best manner you know how?
I just wanted to add, Ro is always so articulate and she's 100% spot on. The only thing that I would add to that is, you know, she said the immediate. I like to think that one of the benefits of doing engagement, especially with the community like trans communities, like MSM communities, like Black and brown communities, is instead of more immediate, I like to give more long-term, you know. Like for instance, on my project, I try to help girls get their names changed, start HRT. If they haven't been introduced to PrEP, then PrEP, you know, things that are more habit forming and long-term, because I always feel that when you engage someone, if they are active in your project, they should walk away better than they came in. And that's just a big belief that I have.
Thank you, Chloe, because I think our communities have a lot of lifting to do, you know, and most of the time it falls on the shoulder of visible community leaders, but sharing that that movement with a lot of other members in their community and having a long lasting like that, it's important. And we're in a really tumultuous time aside from COVID. I mean, trans people are still under attack, and therefore addressing some of these systematic barriers is going to be it's embedded in our engagement, especially with this population.
Thank you both. So just adding to that, like recognizing community engagement has indeed changed. Has there been any shifts in priorities and needs for the transgender communities during the pandemic that need to be considered when doing community engagement? So what are some of the new needs that have arisen post-pandemic?
I mean, I'm just, again, speaking for my area. I don't think that there's any new needs. I think that the needs are just heightened now. The same needs that need to be met before are heightened 20 times, 100 times more than they were prior, right? As part of the prevention trials network, the vaccine trials network, or a part of the unit where I'm board chair at, is that identifying the needs of the community is not just checking a box of what we need for our studies, right? But it's really addressing the needs, right? And if someone at that point in time in their life is one experiencing houselessness, homelessness, then we need to figure out a way to navigate that process with them and for them, being as though we're living in the days of COVID where resources are not as accessible as they were before, right? On a less impacted time, right? Finding housing was hard before, let alone in the middle of a pandemic where securing stable housing, affordable housing, affirmative and safe housing is important, right? Like even in shelter systems, or making sure that people have food in their bellies, right? And again, just, speaking for the experience of those that I have worked with, or even myself, is really engaging me is really going to be like identifying what needs I really have, and trying to eliminate those challenges to accessing the resources that I need.
Did anyone else have anything to add?
I think she nailed it. And I also, think she nailed it even earlier when she said financial, and Ro even mentioned financial. I mean, when you have a demographic of people that primarily perform sex work to survive, survival sex work, and you're dealing with a pandemic that has the contagion rate of COVID, what do? Do you risk your life to eat? I mean, that's literally what you have to do. You literally have to risk your life to eat, in a different way now. We always have before, but now in a different way, when we're dealing with a deadly virus. So I think financial is huge right now, and even more amplified than ever before.
So I have another question. So now that some vaccines are becoming available, has there been any discussion? Do you have people in the community talking about will they take the vaccine, particularly in the trans community? Like, what is that discussion like?
Can I start with that one, please? Yes, that has become one of my pet peeves, actually, because I was ahead of the virus. I saw the virus coming in 2019 before it ever got here. I speculated this is going to get out of control. So I've just been ahead of the curve of this thing, and I've been very knowledgeable about this thing through its entirety. Um, and also, I have, my PI is extremely wonderful, brilliant, very smart. So he's always kept us on the cutting edge because he's an internist. So he's in Grady every day dealing with this thing face on. So he's always kept us on the cutting edge and with all of the latest information regarding COVID. So because I always had this security, I would always encounter people who would have plenty of, they would have plenty of myths for me that I would always have to bust. And I found myself doing this all the time, constantly. If I post a picture in my scrubs, oh, what do? You work in the medical field? We start COVID conversations, and I am vaccinated. And I've had many people contact me. I have people on my social media posts saying, I hope you're okay because I heard this and I heard that. And in especially the Black community, when it comes to vaccine, everything goes back to the Tuskegee Project, the syphilis study, and the mistrust that is of vaccines in the medical community stems from there. And there has to be a lot of work done to regain the trust because this is passed down over generations. No one in my generation experienced the Tuskegee study, but it's passed down. And that information is passed down, that misinformation of what's happening now compared to what happened oh so long ago is still trickling down. So I think that, yes, there's a lot of misinformation about COVID itself, about the vaccine. And then we have so many different vaccines. As a matter of fact, I'm in the hair salon, and the misinformation or the misunderstanding that was relayed to me was that, well, they inject the live virus. And I literally, I'm in a hair salon saying, breaking it down on a microscopic level of what a spike protein is and how they extract the spike protein. And I'm literally breaking this down in a hair salon, but I feel like it's necessary because the more resistance that we have, the longer this is gonna take.
Thank you, Chloe.
Yeah, definitely echo Chloe with the resistance from community, stemming from mistrust. And, in every panel I've talked on, I've literally said that we have to have these conversations, literally just putting all the facts on the table. Like, what do you think happened in Tuskegee? This are the facts. This is the understanding. This is what has come because of that. Like, we literally will have to sit community down and just address the elephant in the room. But what I have seen is that, people are warming up to it. At the beginning of this, people didn't want to hear nothing about it. I've lost friends, just talking about it. But now it's more so people are coming around like, well, I'll see what happens to the first round. I'll consider it, and also trust their sources. There's a lot of people on my social media as well that's recording their journey. And I feel like that's opening people up and warming people up. And what I also like to do is remind people of vaccination. Like, it's been a part of our lives, all of our lives. If you went to elementary school or grade school, you was vaccinated. And the reason why we don't have, a handful of diseases are because we're vaccinated. And, just kind of challenging people's mindset around it, but respecting and validating the fact that, it's rightfully so to be mistrusted. But that's why we have to be more involved to get the informed information. Yeah, but it's been difficult.
Thank you. Did you have anything to add, Rose?
I'm sorry, there's construction in my building,
Okay.
so you'll hear a drill, but there's something I want to put out there for all of us as a resource. There's a couple models out there that are trying to address vaccine hesitancy that everyone is so that they're addressing. And there's 3 components that in this model are ruminating over. And one of them is confidence, trust in the effectiveness, but the system that delivers it, the motives behind those who are participating in distribution. And then another component is complacency, the perception of that risk and how the vaccine will work to prevent it. And then convenience. And all of these 3 things are kind of fucked, for lack of a better word, in America in terms of rolling out vaccines. So you could imagine that vaccine hesitancy, as based on these 3 components, it's across all boards. But what I do find that with the Black and Brown communities, our BIPOC communities, that distress that Chloe is talking about related to past grievances and past egregious action, I don't think that factual information is enough. I think you have to kind of back it up in terms of how other people are carrying it out. And when other people mess up, that makes a dramatic impact to the most marginalized community, and that is our BIPOC community. So what we're seeing right now is that happening playing out. The rollout is pretty bad, and everyone else is fearing the worst. Sorry about that.
I think that one of the main things that, needs to be considered is the pink elephant in the room. And, we can't continue, especially us here, can't continue to be the front lines who have to explain and who have to educate. Because just like she said, just educating is just not enough. It needs to be addressed, and it needs to be addressed by the medical community themselves. Hey, we dropped the ball on this. This is why we dropped the ball. This is how we dropped the ball. This is where we got this wrong. But these are the things that we have done to ensure that you and people like you are henceforth forevermore protected from this ever happening again. It's just like if you mess up, you have to fix it. You can't send others out to fix where you have messed up. And I think that that is something that has to really be considered.
So we have a question from the audience, and the question is like, what are some of the questions that the community needs answers to right now related to COVID-19?
I would say, although you can probably Google this, but just like I said, explaining what are the components of the vaccine? What are you injecting me with? Because it's not really in detail, those questions around the vaccine, its formulation. Why is it that a vaccine for COVID can be made in a year, but a vaccine for HIV hasn't been made in 30? These questions need answers, because it gets a little hyped up, it gets a little murky and blurry, because you're like, I don't know if I trust it. People who may not have privy information to the medical field may not understand that, this vaccine all started with SARS-1, and that the development of a vaccine for SARS has been underway for quite some time, but they don't know this. So it has to be education around it. This is information that needs to be supplied to the people, but also trying to delve down and understand where this actually possibly could have come from without just finger pointing. And what are we going to do to make sure something like this doesn't happen again?
I really like that, Chloe.
Security, Yeah.
Would anyone else like to take a stab at that question?
It's kind of inspiring my own little question of a thought process. I'm wondering if I should even ask, but because I'm not even really sure if it would be helpful or harmful to, not only address, all the wrongs, right the wrongs, but also maybe address perceived adverse effects since the vaccine. We always see videos and articles of people that passed away, passed out, but that's just all that we hear. And I wonder if it will be harmful or helpful to follow up about that. I don't know. What are your thoughts?
Let me say, that's a good point you bring up, because you remember in the very beginning, and I can say that being here in New York too, in the very beginning, baby, they had put all these bodies together and we didn't hear nothing else about them. In fact, they don't even tell you the numbers of the people who have passed away anymore. And I think that's a contributing factor to people like, what the hell is going on? Because we don't really have understanding of what's happening, even if it is admitted that it's kind of like the government and those types of officials are still in movement of trying to figure out how do we document, put this into a spreadsheet, what have you. But the fact that we've seen so many deaths and then heard so little about that really until it was like too late, or if it really just impacted someone close to media. I mean, we've seen CNN reporters crying about being in the spaces with these things, but we didn't hear any type of follow up with what actually was happening. How can we avoid things like that happening? The specific bereavement relief type of thing that could come from that, because a lot of these people are in, you know, especially in New York, there's no ventilation, or if there is ventilation, then people are scared about how that's going through the entire building. You know, if you only have a 5-story building and it has ventilation that way, I know in Brooklyn, a lot of the newer buildings and stuff, that's what it looks like. So people are like thinking crazy things in hotels. I remember over the holiday season when I was with my fiance's family, that was one of the questions that they brought up, like, oh, I don't want to go to a hotel because, I mean, if it's airborne, and mind you, one of his aunts happens to be a retiring flight attendant, she's like, that's where I spent all of my time. So what does it look like for the transmission still? I mean, that's kind of what I've heard, but the point about the deaths is certainly something that needs to be revisited and probably a little better explained, or at least some type of figure as to what's going on and how's that being handled present day.
Right. I would agree. That was a good point, Jamel. Naima, do you have anything that, are you good? Do you have anything to add?
No, I'm fine. I think that for communities that are people that are living with HIV, or trans members who are on HRT, or also folks that are on PrEP, I think that people need information around how this vaccine may or may not interact with their current medication in a more deeper dive, right? Like, we see information out there, but it's really not getting into community as it should be because of the lack of community engagement of like what we used to do in pre-COVID days around informing community members about the effects or less effects of, of vaccine trials, right? Or the medications that we use when we are administering vaccines or any other medication, right? So I think that, you know, hearing from other community members that are like connected to leaders who are educating communities is like, these are the questions coming back, is that, will this medication or would this vaccine have an interaction with my HRT, or have any effects on my organs where, you know, I'm already, you know, altering them with HRT treatments, right? And if they are a person with HIV, does their effectiveness of their HIV regimen, will it be lessened because of the vaccine, and will it heighten their chances of acquiring severe symptoms if they do get symptoms of COVID, right? From the vaccine. And we know that the vaccine is not the virus being introduced to you, but like a makeup of it to wake your immune system up to fight it once it is introduced. But these are questions that come. It's just like with the flu vaccine, you know, everyone has questions and also historical trauma around vaccines and treatments, right? And I think that just like we spearheaded a lot of our education pieces around other vaccine trials or around other treatment plans, we need to educate around this as well, just to combat the myths that folks have, or the uncomfortableness feeling that they have around getting a vaccine.
Thank you, Naima. So before there was COVID-19, there was HIV, and a lot of our focus was HIV community engagement. I know I've been in rooms with a lot of you all with around HIV vaccines and prevention trials. So what the question is, has it been difficult to engage communities in conversations about HIV during the COVID-19 pandemic? So is it hard to talk about HIV now with all the focus being on COVID-19?
I'll take a stab at this.
Okay.
And I'll give two answers. One of them coming from a community perspective versus the interface with the public. And I find that with our COVID-related work, people were coming to our studies thinking that they would have access to it. So it's kind of a self-selecting audience. But I have to say that that audience that came to us thinking that they're going to get a COVID vaccine, the real COVID vaccine versus the experimental clinical study, I remind them constantly that we got to where we're at today with COVID because of all the work that we've done with HIV research, and reminding them of our history. And I kid you not, every time I bring up HIV in that conversation with predominantly with an audience that's heteronormative, it opens up their eyes. They seem to be a little bewildered about like, what happened to HIV? So this long conversations. Now let's talk about our community. Something that's really sobering is that in North America, we reached 500,000 deaths related to COVID. But then when we compare that to HIV in North America, since the beginning of the pandemic in 1981, we've lost 750,000. That's over 30 years. So one of my biggest questions I asked them in the community is like, do you know anyone who had COVID? Not to like get the tea, as opposed to like the proximity of it. Because with HIV, most of our community members have been impacted deeply by HIV. But when it comes to COVID, knowing that it has destroyed a lot more lives in a short period of time, that's the conversation I'm having with people as it relates to HIV. And that's what keeps the HIV conversation alive with me with that community. So with my trans girls, you know, when I'm giving this reality check of like, this is not the flu girl, like we lost 500 compared to 750 in 30, 40 years. And when I asked them, like, do they know anyone? That's like a real reality check for a lot of them. So it kind of reinvigorates like, wow, I've survived HIV, which is always a perspective that is profound for our community. And then reminding them how they can move forward, stay HIV negative or still accessing their treatment and medication. Like all of that is really important because no one wants to survive HIV and then die from COVID.
Right. Excellent point, Rose.
So from a legislative point of view, back to the capitalist points as well. HIV is still the moneymaker. It was, you know, that's still what it is. So if you've been paying attention to the news in Atlanta lately, you know, $15 million being pushed for, you know, new HIV movement in Atlanta. It's still happening. It's still maneuvering. I think, I think the research that needs to be done on COVID, how it relates to those social determinants of health and like intertwining, it needs to be some type of research that goes together in how that could be like merged. I hate to say it that way, but how that can merge into the type of funding and accessibility that specifically we're talking low income here, specifically low income developed communities can be a part of that accessibility to all the vaccines, right? I seen the report also, as I found out the 35% yesterday, that the expansion of the accessibility has been to restaurant workers, on to those who have compromised immune systems here in New York. I think it probably will be a universal thing, especially since this new announcement that's coming from, I'm not sure if I'm allowed to say it, the merging of the decision that President Biden has made with Johnson & Johnson for the dissemination and the facilitation of two big warehouses that will be manufacturing, you know, the vaccine in such a way. I'm confused as to, it's not the question of whether it's like more important, one is more important than the other. It is kind of a simultaneous conversation that needs to happen. But the front facing question continues to be, how are we going to make sure that funding goes to the communities that need it the most? i.e., we don't even speak about rural communities, you know, those who may not even have the understanding of how this vaccine is going to impact them. I mean, you're talking about people who live like a mile away from each other, or, you know, just any of those types of things. Those are the questions in the scope that needs to be paid attention to, or we will come across the problem that we've had with HIV, which is the people who are not getting service because they're not in metropolitan areas.
Definitely, Jennifer. I am from a rural area, Albany, Georgia, so I know that all too familiar. DJ Mel, did you have anything to add? So
They
switching
hit right
gears,
on it.
we have another question from the audience, and this is jumping back to medical mistrust. So the question is, some people have called Tuskegee a scapegoat to avoid addressing the real causes of medical mistrust. The barriers that are limiting access to the vaccine and people of color communities are not being sufficiently addressed. What do you all think are the most overlooked barriers that must be addressed? So, what are the overlooked barriers that must be addressed in order to um, debunk medical mistrust?
I have to wholeheartedly agree. I mean, access is number one, you know. Um, if I'm unemployed, if I'm uninsured, if I'm underinsured, I mean, even if I do have insurance, but my insurance isn't worth anything, you know, how do I access this? How do I get this? Um, if I don't have access to a primary care physician, you know, how do I even access this in the first place, even if I do want it? So I have to agree. But I don't think that well, let me just say, I would have to say that it could be seen as a reach to say that, Tuskegee is just a scapegoat. I kind of think that it's a compounded issue. You know, it's all of it. It's not just one or the other, it's all of it. You know, it's mistrust there, it's lack of access there. You know, that's the thing about community engagement. And I think that's one of the things that all of us have in common is we engage with people who have not previously had access, whether it's to PrEP or treatment or whatever, PEP. So that's one of the overall things is access. And that can, and Jennifer just expanded that, what access means, not just in the trans community or community of color. But now when you just take that to a macro level of rural areas, not having access. So, just to answer the question in short, yeah, I don't think it's I just wouldn't say it's a scapegoat. And the reason I wouldn't say it's a scapegoat is just because the powers that be aren't willing to address that anyway. Honestly, it's not like they really throw it back at you. I think that it's just something we know is common knowledge. But once again, yeah, access, and also care and treatment once you get there. What am I going to be treated like when I get there? Am I going to be treated like a piece of trash because I don't have insurance or because of whatever reasons? What am I going to be treated like when I get
I was actually going to segue right into that, Chloe, is like patient experience. That's a huge barrier is negative experience. How do I, if I go to, when I go to the doctor and I feel discriminated or judged or dismissed, why do I feel like the doctors value my life enough to make these vaccines that's going to make my life better? Like, it has to be the experience across the board and not just when they want me to be involved. So yes, good point, Chloe.
Thank you both. So what I hear is that community engagement is important overall, like to address the access issue, but overall just make sure that community voices are heard. So what are some best practices when conducting community engagement throughout the pandemic that would you give advice to someone, like best practices for community engagement in the pandemic?
Advice I would definitely give is being patient and to meet people where they are, and respect, people's experience, even if it is around mistrust or misinformation, validating that it comes from a place that's real. And so I know for me, it's been more important for me to put the information out there, offer the information, than to feel like I'm pressuring people to see about the study, come in about the study, or like feel like I have to just shove all this information down their throat at one time, trying to pace it out, trying to give people time to process and do their own research. So I would definitely say be patient with it. It's not a quick answer, not an overnight thing. You have to meet people where they are.
I would say a big part of community engagement is never assume that one person experience is similar to the next. Because when we assume this, the resources that we're offering are siloed to a community and not specific to an individual. So going into a community engagement environment with an open mind and open heart, and definitely resources that's going to encompass anything and everything that a person in need could possibly need, pretty much. So don't make an ass out of yourself by assuming.
So,
I would say one more thing. I think that, when we hear community engagement, we think of all the external components, but there's a humongous internal component, and it's self-care. So make sure that you are overdoing your self-care, because you need it right now. When you're getting so much depression, so much just dark energy, negative energy, desolate energy, hopeless energy coming your way, you definitely need to be prepared for that, because if not, you won't be effective for the community. You won't be able to. So I think beef up your self-care right about now.
yes, I'm big on self-care myself. Like, I have a massage book today. So, while doing community outreach during the pandemic, has there been anything that you all like realized you weren't doing before that you should have been doing, or were there any takeaways like, hey, now that I've been doing this in the midst of the pandemic, I'm going to start doing that like once this COVID-19 thing is over? Like, any takeaways?
What do you mean, like as in cleanly practices or like?
Just overall takeaways and the way you would
I mean, because it showed how disgusting America is. I mean, honestly, I want to be clear. Like a lot of the ways of the contraction have been from people who are not paying attention to washing their hands, touching their face, literally putting on, like, I mean, honestly, and we laughed at, let's be clear, the general public laughed at a lot of the mechanisms that were made at the beginning of this pandemic. And now everybody's wearing them and want a piece of everything that can cover you from here. You know, we laughed at people that were walking through the airport in full suits. I mean, Naomi Campbell had been doing that for decades. You know what I'm saying? Like, it's one of those things like, I know my fiance and I, first off, we live in New York City, which is one of the grossest places on the planet, but most beautiful as well. But with it being so disgusting, he had been washing his hands all the time. Like his commute was back and forth from Brooklyn to New York every day. So that whole movement of being outside and stuff should have been a part of our regimens in general in our household. We have got to understand that. Looking back at some of the stuff, like we watch American Gladiators all the time, looking at some of the ways we just interacted with one another, it almost makes me cringe, because I never even thought about the way that one's personhood, you know, interacting with someone else's in that way. Just anything could happen, you know, just things, I mean, blow it off, kiss it to God type of stuff. Like all of that fallacy that we had really brought to light of it could end your life. I think practices for myself that I found in routine more so has to do with immediately keeping myself covered in certain ways, like my hands, more specifically, the mask, of course, you know, a mask for every type of occasion is just a thing now, which I hate wearing masks. But I think continuously normalizing and never stopping saying that in addition to getting the vaccine, you still need to wear a mask. In addition to recovering from COVID-19, you can get another strand or get it again. Like those things need to be ingrained in the conversation rather than you're cured after 14 days, because that's what the story was. That's what it made it seem like for people. And they were just like, okay, well, after 14 days, boom, I'm done. And we can keep it moving. You know, it's not a movie. It's not a beach party scene after you recover. It's just really not given that. So.
You know, I'd be remiss not to mention harm reduction, something that was born out of our work in HIV that could be applicable in the COVID reality, that in terms of like best practices moving forward, I'm consciously aware of how stigma is perpetuated in COVID world. So for example, last year during Pride, the House of Noir, several of the trans Black femme or action group organized a Pride at a public park. And I remember how much shit they got from folks outside of that community witnessing or hearing about this celebration. And I just only want to bring that up because stigma is real and it perpetuates itself, and it further stigmatizes our community even further. You know, dealing with HIV and then now dealing with COVID on top of that has been horrifying. So yes, I'm sorry about the noise.
Well, thank you, Ro. Moving on to the next question. Are there any new trans relevant spaces that have been created in the virtual world or otherwise where you find community? So in the midst of the pandemic, have there been any new spaces created?
I can say yes. Like I said, even for my project, we made everything virtual. So we began this, we call it a coffee hour because I work for Emory University. So we can't call it a happy hour or anything that could insinuate, narcotics or alcohol or, but so we have to keep it PG, and we call it a coffee hour, but it's just a safe space. It's nothing particular. It's just a safe space, and it just gives our participants a moment to still engage. And I've personally engaged with my CBOs, like the CBOs that I have partnered with on this project. I still engage with virtually because they didn't have a virtual space previously, but now they do. And I have still personally been able to, keep contact with community through this virtual manner. It's not the same though. It still isn't the same. And it still doesn't have the same benefits, and it still doesn't have the same sense of connection and connectivity. But the spaces are there. Once again, to D. Jamel's point, people are zoomed out, I mean, it's Zoom spaces everywhere. So yeah, the spaces are there. But once again, do I even feel pretty enough to get on a camera today? Do I, have the energy to get on a camera today? Am I up for it? Also, there's a communication gap when you're communicating like this because, microphones, I don't have internet, I don't have a computer, or my phone has a bad camera. So there's these gaps there where it once again, back to access. Everyone doesn't have the access, but they.
Thank you. And so just moving along with community engagement and talking about access, what advice would you give a PI, a community educator, a legislator, or a friend who is having difficulty engaging the trans community? Like, what would you tell that person?
I can tell you what I'm telling my PI right now every Wednesday morning at 9:00. We got to do something. We have to do something. We have to be a little more experimentative. We have to go a little more outside the box. called and considered a neurovirus. You know, this is something that is new. This is a neovirus. I'm sorry. This is something that's new. This is something that all of this is new to us, to our generation. Maybe people who experience yellow fever can relate, or in the previous generations, but this is new for us. This is a totally new experience. Walking around masked all day, every day is a totally new experience. Even information like earlier, Jennifer said, you know, airborne. Airborne. What does airborne mean? I mean, does airborne mean that it's just floating around, you know, the air outside and I can't inhale it? Or, you know, what does that specifically mean? Which, you know, it's more like aerosol, you know, there's a level of flotation and then it falls. But just education around that, for instance, just trying to find a way that is different than we've ever done before, because that's what we have to do, in a way that we can still have that feeling of connection, still have that feeling of understanding, because that's what people want to feel. They want to feel that you understand what they're dealing with. You want to, you know what they're going through, but yet and still maintain safety, because right now it's just like everything's about safety without taking in consideration of the person.
Right. So we have another question from the audience, and it says, what intervention should be created to address health outcomes in the transgender communities? So what intervention should be created to address health outcomes in the transgender community?
I just have this notion, if I may say, about questions that are framed in that type of way, like speaking of transgender people as if they're not people. I think there is a issue with the intentional segregation of what a person of trans experience is, rather than holistically trying to understand and empathize with this person and who they are, right? It's not a science project for you to display unless it is research based, right? So there's a separation of the scientific understanding of this person and then the engagement of this person as who they are and what they need. I think that's a big part of why there has been so much issue within these communities, is because you cannot put these people into a bracket of, i.e., they're not human, so what can we do with this thing? And that's how those types of understandings are spell outs in language and on pamphlets, and that's how that looks to people. And I can tell you myself, because identifying as a woman of trans experience and in that manner, it always says to me, like, you're still a thing. So I want to give to the space the understanding that if you just decide to engage with these people in a more natural way, as if you would do with your own type of friends, that may bring about a better way for you to understand what the need is for that person and the people they're attached to. Because remember, every person does not need the same thing. Every group does not need the same thing. So it's going to be a continuous development of what these people need access to, help with, and education on. So
Thank you, Jennifer.
I really hate that question, because to me it's like common sense. You know, what does any disenfranchised community need? I mean, you know, honestly, and it's like we know better as human beings. We know better. I mean, we as humans have witnessed and experienced over generations genocides and, you know, slavery and you know, the Holocaust. And what did everybody need? You know, I mean, what do you think any person needs? You know, when you rescue a dog from a shelter, what does it need? You know what it needs, right? So why is it now that when it comes to this community or demographic that you deem is a little different, Well, I don't really understand. What is it that they need? What can we do for them that would really help them? What does everybody need? What does anyone who has not had opportunity, who has not had advancement, who has not had, finances, what do any of them need? Regardless of color, whatever, gender, what do they need? That to me, I think is common sense.
If I may say also, Governor of Texas just opened Texas back up to 100% effective next Wednesday. I, what do you do? Like, what do you do? How do you combat those in power? And I wanted to say this earlier as well. We didn't have leadership, any type of leadership when COVID hit, right? What does it look like for these leaders of these big states? You know, we had this big discussion around electoral colleges and the power that these states have. What does it look like for the influence of these people who are heading these studies, right, to have conversations with these types of government officials in order to put into movement and legislation to not have things like this happen? I mean, against the humanity of the other people in the state. You know what I'm saying? Like, I just continue to see things like this. And of course, this is like 20 minutes ago. I can't believe that we're allowing this to happen. And you all, of course, doing the work in scientific field. And then of course, for the experts, where does the power come from the scientific community into what the decisions are made statewide? Like, that needs to be something that is more pressed as well. So I'll be looking into that personally myself and trying to get information on how we can move that back and forth, because this can't continue to happen, because it'll be obsolete. Anything that you're doing will become obsolete.
Did you have something to say, Chloe? I saw you went off of mute.
Yeah, I just had to take a breath.
Okay.
I did, because this is where that rift comes in from, when you have medical versus political. And medical is supposed to impact and influence political. That's the way it's supposed to go. That's the design. All of, this, for instance, like let's say the NIH, they're going to provide the funds for this medical research to be done so policy can be implemented based off the research that you find. And I really hate saying this phrase, but the previous administration separated that with a vicious partition where it's null and void now. The medical industry really just has no say when it comes to, I mean, we can say numbers have shown, studies have shown, this is happening, that's happening. When it comes to politics now, and this is really more so recent, because before, like in Atlanta, if you said, if the CDC said, hey, we're having an HIV outbreak, they're jumping on it. Money's going to be sent there and resources going to be provided. But yeah, and it's really disheartening, because I hate to be one of the previous administration people, but I mean, there's no workaround that, yeah, there's no way you can answer that without saying the previous administration disconnected medicine and politics.
Right. So we are almost wrapping up. Did anyone want to add on to to that question? So as we approach our last minutes, what are some final thoughts that you all would like the audience to know, recognizing the news about Texas and just overall where we are? We do have a new administration, but the pandemic, we're still in the middle of a pandemic, although vaccines are available. So what would you tell the audience overall? And I can start with you, Naima.
I just took a breathe at so I mean, in closing, again, treating the trans community, and this would be, not co-signing, but just, one up in everything that we've already said on this call, treating the trans community like any other community, and also, going with the intentions, being intentional about the genuine care that we're providing people, and meeting the needs, and one experience is definitely not like the next. So don't assume, and just really be intentional about the care that you want to provide to all of our communities. I guess I'll pass it to Chloe. Is that how we doing it?
Yes.
Yeah. Chloe, go ahead. I'm sorry.
No problem. Thank you. In closing, I would just like to say, let's not forget the epidemic in the midst of the pandemic. People are still acquiring HIV, and people are still dying from complications of AIDS and HIV. So let's not forget, just because we have something that affects the general public more across color barriers, across gender barriers, across sexual preferences, and because it is seen that HIV only affects and it doesn't affect mainstream, that's not true. We still have a problem with HIV, and especially here. So let's not forget that the pandemic, I mean the epidemic during the pandemic.
I guess in closing words for me, I guess I just really want to emphasize on the fact that it's everybody's responsibility in efforts to end this pandemic. It's not just the scientists or the medical world, it's not communities, not just us, it's not government officials, it's everybody playing the part, down to government officials, scientists, PIs, community educators, giving out the right information, addressing these social determinants, and also community being more open-minded and receptive to the information, asking the questions that drive your perception, or being open to debunking your misinformation or whatever, but just bridging that gap of understanding and information and knowing that we have to come as one to beat this and to do this.
I think Jennifer is blowing over Texas.
I am just, I
Jennifer.
cannot believe it. I can't. I have so many family and friends there. Like I can't believe it, I have so many calls to make, and mind you, I've been in meetings all day and school. So when we were starting this, I was in school. Like it's just like never ending. Let's see. Final thoughts. I want people to breathe, pause and reflect, and really engage with only the things that would make you either A, less susceptible to obtaining this illness, like this virus, not a game. Because mind you, we don't even know what's going to happen after you recover. We don't have time spent of that at all. And according to my fiance, it seems like that there's an issue going to be with your lung. Like you're going to have an issue. Like it's just like breathe, reflect, and your best course of action to preserve yourself. Like move in those ways now, because clearly I agree with G. Jamel 1000%. It's nobody's going to save us. Clearly, nobody's going to save us. And you really have to take responsibility for your own health, i.e., that means more than just this pandemic. It means more than the epidemic. It means essentially your being needs to be paid attention to. So that's all I got.
I just want to thank each and every one of you all for being a part of this panel. I have learned so much, and for sharing your space, for sharing this space with me. And I'm really overwhelmed. I enjoyed you all a lot. And this is my first time moderating the panel, and y'all made it so easy. Oh, we
You did
have
a wonderful job, sweetheart.
thank you all who are watching us live on Facebook on behalf of the HVTN and TAG and the co-VPN. Please be on the lookout for episode 3 of the HVTN Community Cafe Talks. I am Abraham Johnson, HIV Community Engagement Officer for TAG. Thank you all and have a great day.